Okay, hello everyone and welcome. I am so excited for this next session, egg freezing. Today we're joined by an incredible panel of experts and thank you all so much for being here today. We're really looking forward to hearing your insights to help us better understand the egg freezing process. Now, before we dive in, I'd love to hear a little bit from each of you. Could you introduce yourselves and tell us a little bit about what you do? Dr. Najat, would you mind kicking us off?
Absolutely. Thank you so much for being here, everybody. Ed Najat, founding partner and practice director at Generation Next Fertility.
Fantastic. Dr. Swanberg?
Sure. Hi, I'm Sarah Swanberg. I am a doctor of acupuncture and Chinese medicine and owner of Indigo Wellness Group. We are a collaborative care practice up in Connecticut. We have Stamford and Westport, Connecticut. We have an amazing team of providers who really love to focus on the fertility, pregnancy, postpartum space, and we're really happy to be here.
Amazing. Dr. Wu?
I'm Dr. Jennifer Wu. I'm an OBGYN here in New York City. We have offices in Tribeca and the Upper East Side. And I really love getting to know patients throughout their pregnancy and being there for that special moment when the baby is born.
Oh, love that. Dr. Sechkin?
Hi, everybody. I'm Dr. Sarah Sechkin. I'm one of the fertility specialists here at Generation Next Fertility. It's very nice to meet you all. I love working with patients, meeting their goals, meeting them where they are. And I love educating patients and families. And that's why we're here today, to learn more about egg freezing,
Right.
fertility preservation, and what that can mean and do for individuals.
Amazing. Thank you all so much. So, Dr. Wu, I want to kick it off with you because as an OBGYN, I'm sure you see so many people who could benefit from egg freezing. And I'm curious as to when you recommend people freeze their eggs.
I think I have the conversation about egg freezing 4 or 5 times a day. And you'd be surprised. I actually talk about it with very young patients, patients that are 22, 23, 24. Usually these are young patients at their first job and they're at these big firms and they have excellent insurance and they often have egg freezing coverage. And so these are patients that will later on go to work for startups or for themselves and where they don't actually have access to good coverage. And so I tell them, you're working very hard. You have very good benefits. Think about doing the egg freezing now while you have coverage. I also talk to patients who are in their late 20s, early 30s, and say, if you're not thinking about having a baby anytime soon, you may want to freeze the eggs. This way, there's no time crunch. You don't feel rushed to marry somebody and have a baby. This buys you time. And you just, don't have to worry so much if you end up meeting somebody when you're 38 or 39, which is often the case here in New York City.
Yeah. I love that advice, and I definitely would agree. Now, Dr. Najat, as a fertility specialist, what are the most important things you want patients to know about fertility preservation? And what is the egg freezing process really like?
Sure, I'd be glad to talk about those things. And Dr. Wu, it's great to hear the perspective that you have because, of course, the patients oftentimes are seeing you before they see us. Sometimes they'll come to us directly, but I think that those very important conversations with their OBGYNs, often those long trusted relationships, is a great time to help educate patients on what the possibilities are. We have a good sense that fertility peaks in the 20s and declines in the 30s, and freezing eggs during those peak fertile years can offer some really great advantages for women. The process would entail an initial consultation with a fertility specialist where we would take a history, ask questions about family planning goals, how many kids people want to have, timelines, when they want to get started. And we would do an ultrasound, look at the uterus, look at the ovaries, do some basic blood work, looking at hormone levels, specifically AMH, anti-Mullerian hormone, which is a marker of egg quantity. Also, specifically when we're doing the ultrasound, we look at the uterus, make sure its shape and size are normal. And also when we're looking at the ovaries, we're doing an antral follicle count to see how many follicles are present. Antral follicle count and AMH are two markers of ovarian reserve or egg quantity, which gives us a sense of where a woman stands in terms of the number of eggs remaining in the ovaries, because women are born with a finite number of eggs and that number declines throughout the reproductive lifespan. So by doing this egg reserve testing, we have a sense of if someone is average, above average, below average, and that can be very informative in decision making as far as egg freezing, how urgent it might or might not be, in conjunction with someone's family planning goals. Once we've done all of that baseline testing, then we'll have a follow-up consultation, and if a patient wants to proceed, the process in a nutshell would entail about 2 weeks of injectable medications, subcutaneous injections just beneath the skin. During those 2 weeks, patients would come in to see us about 3 or 4 times a week for blood and ultrasound at each visit. When the ovaries were ready, we would then schedule the egg retrieval procedure, which is done in our office. We have 2 operating rooms. We'll have an anesthesiologist with us, IV sedation. Patients are asleep for the procedure. While they're asleep, we remove the eggs from the ovaries. That takes about 10 minutes. Then they'll recover in the recovery room for about an hour and then go home.
Fantastic. Thank you for that explanation, Dr. Najat. That made it very clear. Now, Sarah, as an acupuncturist, I'm sure you help so many patients through their fertility journey. What advice do you give patients during the egg freezing process? When do you recommend, for example, that patients start going to see an acupuncturist?
Yeah, it's a great question. We like to think of ourselves as sort of the support system around what you guys are doing. So in effect, during the egg retrieval process, it's sort of like hijacking the system, right? To get to this end goal of like, let's get as many amazing eggs out as we can. So how can we support your system through this? Both very exciting and sometimes stressful period. And so we use acupuncture really in the months leading up, if possible, to this process, get everything as optimized as we can. And sometimes we're really focusing during those couple weeks of sim meds of really reducing side effects, trying to keep your body feeling as safe and supported during this pretty aggressive time period. So sometimes it'll be acupuncture with us, really focused on blood flow to the ovaries. Sometimes we're really thinking about sleep and digestion and other ways that we can get everything optimized. We'll have people work with our nutrition team sometimes in the time period leading up if they're experiencing issues there or have a lot of inflammation going on that we can target nutritionally. We really just also are kind of coaching our patients through this process of, how can you find other calm in your life? How can we reduce, the stress that we can? And we can't always change the lifestyle, the busy, we have a lot of patients that are in their early 20s, they're really career driven and they have a lot of stress or they're traveling. Yeah. So we can't really change that, but what can we add in to the day-to-day to make this process a little bit as smooth as possible?
I love that. Now, Dr. Sechkin, I have to ask you. I think we all kind of can share this sentiment, right? It feels like everybody's coming in for egg freezing. Now, why do you think that is?
Multiple different reasons, and the main one is where society brought us, and the delayed childbearing that comes with being more career focused, education focused. And society-wise, we also tend to fall into doing things that everybody around us are doing. So in New York City, that's how things are more so going. It may not be like that in different areas in the country or the world. So because of delayed childbearing and because it has become much more commercially available. So it's unimaginable a certain number of years ago that insurance would even cover it for some people. Technology has gotten better. Anecdotally, like person to person, patient to patient, girl to girl, you find that people are having success from it too. So finally, we're getting to the population where people do end up thawing them and using them, and people share those experiences, whereas that wasn't the case 10 years ago.
Right.
And of course, along with successes, people hear about the caveats as well, that it's not a guarantee. But so education about it, what limitations are, is the most important thing, and that's increasing, and that's why many people are coming to do it.
I love that. Now, Dr. Wu, I want to go back to you because you had mentioned that you tell a lot of younger women, especially with the fertility coverage they have, they should think about freezing their eggs. Now, let's say someone is in a relationship and they want children, but they're with a partner who doesn't, or maybe is not sure if they do. What do you recommend they do?
I recommend they do egg freezing. I think that, unfortunately, women do have a finite time where they can harvest their eggs and the eggs are good. And unfortunately, many men don't decide they want children until they are older, and their partner may be too old to then use her own eggs. So if you know that you want to have kids, or if you think that you want that option, you probably should freeze your eggs for you, just in case.
Now, have you ever given them a suggestion about freezing eggs versus embryos?
So patients will often ask me about that. And, especially if they tell me that they're not sure their boyfriend or their partner is the one forever, I do suggest freezing eggs and embryos possibly.
Okay, so you're thinking maybe half and half.
Exactly.
Gotcha. And now, when we're on the topic of embryo freezing versus egg freezing, I'd like to pose this to Dr. Neja. What do you recommend? And what are the success rates between the two?
These are great questions and really boil down to the nuances of a woman's goals, her relationship with her partner, and how confident she is that this is the sperm that she wants to commit her eggs to. We can freeze eggs and embryos in any, split that a woman wants. We could do 50-50, we could do all eggs, we could do all embryos, we could do 75-25, and we've done all of those paradigms depending on how many eggs we expect to retrieve, how many cycles someone wants to do, how many kids they want to have, and their degree of confidence that this is the sperm they want to commit to. So those conversations happen early on with us at Generation Next, and I think are really critical in helping patients get to a level of comfort where they have the right number of eggs and or embryos frozen so that they can achieve their family planning goals without the stress and the anxiety of having to do so in the near term.
I love that.
And there are additional factors that play in, because when we freeze eggs, we don't get as much information about the eggs as we do as if we try to fertilize the eggs, and we know how many eggs fertilized normally, how those embryos then progress through the stages of embryo development, and then we can perform pre-implantation genetic testing, PGT, where embryos are biopsied, a few cells are removed from the embryos are then frozen, the biopsy samples are sent to an affiliated laboratory where those biopsy samples are analyzed to see if an embryo has a normal number of chromosomes versus not. So then we have a lot more confidence if an embryo is quite likely to become a baby, if it has normal chromosomes, or really has virtually next to no chance of becoming a baby if those chromosomes are abnormal. So when we are freezing embryos, we do have a lot more information about the embryos compared to when we're freezing eggs.
I love that. Okay, that's interesting insight. Now, Dr. Swanberg, let's say we have this patient, right? Is there a way that acupuncture could help with egg quality or egg quantity?
It's a great question, and it's a kind of hot topic, right? Can we affect egg quality? And I think there's a lot of nuances to that conversation. And we're born with the eggs that we have, and so I like to use the analogy of like the seed packet that you get at the garden store, we're not going to change that, but can we change, and would we, if we really wanted a good, a great tomato plant, we're going to think about the soil that it's going in, and the water and the light. So we like to think about the environment that egg is going to then develop into, those the follicles are going to develop into the eggs that then will be retrieved. So yes, I think of course we should be doing everything we can in the environment around that to affect the quality of those final eggs. Quantity, it's hard to know. I mean, I really think that's the game of the fertility doctors. You're using the meds to try to get to that number. But I do think we're seeing now women who've done multiple rounds of this in different environments. We've had women who've done their first retrieval at maybe 28, and maybe lifestyle wasn't, I mean, I don't want to speak to my lifestyle at 25, 28. I was not optimizing things, and then they come back and they do it a few years later, and they're really then focusing on inflammation, diet, lifestyle, and they're getting better results sometimes in that later round when you would expect things are kind of going in the opposite direction. So my answer would always be yes, we can affect the end results, and acupuncture is a big piece of that. And what we know acupuncture can do is really affect blood flow to the reproductive organs, and affect that the way our bodies, our brains, the way the hormones, the cascade of hormones are happening. So we see better results when people are coming in regularly in those months leading up. But we also see people who are like, hey, I'm doing my retrieval in 2 weeks. Should I come in now? And I say, absolutely. We can definitely affect the way you feel during this, the bloating, the side effects, and potentially the outcomes as well.
Amazing. Now, I want to talk a little bit to Dr. Setchkin about empowerment. As somebody who went through the egg freezing process yourself, what does it mean to take control of your reproductive future? Any advice or insight as to how it felt for you?
So I went through the process at a more, I guess, right on the border of what we call advanced reproductive or maternal age. And for me, it was to take control in terms of having another future child, because I had already had a child. And the purpose of doing that is because I've seen it. We've seen it all. There's so much more to see. But it's to know that in the future, any eggs that are retrieved are not going to do as well as eggs that we get at a younger age. Although it's not a guarantee, what we do today is an increased chance in the future to have a child that's genetically related to one, if that's the goal. So doing so is like investing in yourself. It's not a full insurance policy, but it's investing in yourself, and it's taking action with the information that you know about your body. But of course, there are things to face in the future in terms of what are we going to do if this doesn't work? What if financially it's not feasible? All of these things have to be considered and taken into account when making the decision to do it or not, or to do another cycle or not, if you're not happy with the number of eggs you had frozen from a single one. So for me, it went, and I tell all my patients this, that not every thing turns out, not every egg you see in the beginning, you get in the end. And there's steps of attrition that occur along the way that happen in vivo, and it happens in vitro when we're doing these things as well. So for me, I had a pretty average egg count, and I was like, okay, maybe I'll get like 11 to 15 eggs out of this based on my starting. And then on the day of, we only got 11. And I was pretty disappointed as on the patient side, and only 6 were mature. So out of something that I thought that I could get like 15, I got less than half of that. And it's so be prepared for that, and just having a good channel of communication with your doctor and your team of like what's expected, what's good.
Right.
Even anything you get is better than not having it. And it gives information for what to do next time. So some of these things that are, beyond that one standard deviation of you give this medication, this is what we expect to get. Some of those things you can adjust within a cycle. Some things you don't know until afterwards. And again, with eggs alone, you don't know. You don't know until you actually fertilize them and see what happens.
Right.
So but the caveat is you need sperm to make embryos. So for me, yes, I have a partner, but he was not available on that day. So there are hiccups that can happen anytime in these processes. So it's just good to be prepared.
Amazing. Thank you for that advice and thank you for that perspective. I know a lot of people listening were really hoping to get that experience and get that insight. So I know we have a lot of questions that were submitted from our audience, so I think we should just dive right in. Yeah? Okay. Let's kick it off.
Okay.
How do we approach the questions, Destiny?
Here we go. All right, there it is.
Oh, there we go.
Are success rates for egg freezing and other fertility processes the same everywhere? Dr. Najat or Dr.
Yeah,
Setchkin?
I'd be happy to jump in. I would give that a strict no.
Okay.
They definitely differ from IVF center to IVF center, and I think it's important that patients speak with their doctors about likelihoods of success before they really embark on the journey, so that they can get a sense of what their true expectations are, because a lot of this process is setting those expectations in a way that is honest and accurate and realistic, so that patients understand what's likely to happen, what's possible, because without that, it can become really difficult, a really difficult experience when the desired outcome is not achieved, and there can be some pretty intense disappointment without those proper conversations.
Thank you, Dr. Najat. Next question. What is considered older? I'm 29 and plan on trying for children next year. Please feel free.
So our medical definition of advanced maternal age or advanced reproductive age is age 35 or older. But I tell my patients that's not old, but the ovaries are on their own timeline as well. So 29 is still considered young, but very important to know that the goals that somebody may have in their very early 30s and what quality we expect can completely flip within a 10-year span or even less. So that's the optionality that things like fertility preservation gives us. So even though 29 is young, it very quickly can turn into something else, and we don't know. We don't know. We have to be prepared for it and at least be educated on how things can possibly change. So at age 29, we out of embryos that are made, and if we know what the genetic normal or euploidy rate is, because when we biopsy embryos, we see what that is. At that age, perhaps 70% of embryos would be chromosomally normal, but rapidly at 35, 36, maybe 50 to 60%. So, and then it changes that decline becomes more steep after that. And after 42, it may be very, very hard for people to make normal embryos. So all these changes happen in a very narrow constriction of time. And yes, we understand that egg count goes down with the time. We understand that, but it's very unfair that egg quality goes down in such a short span of time.
Amazing. Thank you for that answer. Next question. Okay. How often should someone receive acupuncture during the egg freezing process? Dr. Swanberg, I think that's all you.
I usually say if we can, ideally start a few months out, 2 to 3 months out, and we start weekly, then that would be my ideal recommendation. That doesn't always work in people's schedules. So we're trying to get them as much as we can in those few months leading up to it. In those 2 weeks, really, when they're doing the meds to stimulate, I say at least weekly, biweekly, ideally.
Okay, great. Next question.
Sorry, can I just jump in there as well?
Yeah, please.
I just want to say, from the physician perspective, partnering with acupuncturists can make the process for patients so much less stressful and have them feel so much more supported throughout the process, because while we as physicians, we offer to be as accessible as we can. We're here to, speak with them whenever they have questions, help them, do the ultrasounds, whatever the case may be. To have those additional touch points with someone like Sarah, who has the experience to speak with them and take them through the process from a more holistic standpoint, I think can really make a super stressful experience a lot less stressful and more empowering and just better. So I can't emphasize that enough.
I love that. That is so valid. Okay, next question. Okay, success rate for egg freezing, then success rate for embryo, then success rate for embryo to become baby. Wow. Okay. Whew, that's a lot.
So it's based on many different things and varies person to person, but in general, in ages less than 35, based on the number you have frozen, there is an estimate of what the chance is that it could make that result in live birth. So under 35, 15 eggs are associated with about an 83% chance of having one live birth. And of course, for 2 and 3 children, it's less than that. For 20 eggs, about 90%. For 30 eggs is about 97%. So never 100%, even if you have 100 eggs. And that, of course, adjusts with age, and that's the average. It varies person to person. Once you have an embryo, it depends, again, if it's untested, depends on the age at which that embryo was made. But if it's a tested embryo, typically pregnancy rates are about 60% with a tested embryo. And then, so let me go back to the question and see if I'm missing. Yes. So, but success rate for embryo from a single egg. So a single egg, it has to survive all those attrition steps like we talked about. So it has to survive a thaw, which is about 90% of the time eggs survive thawing. They have to be fertilized. So 80% of eggs are expected to fertilize normally. And of the ones that fertilize, about 50%, but also based on age at which the eggs were made, make it to a blastocyst, which is a mature embryo that can then be biopsied if desired for genetic testing. And then the genetic normal rates are also based on age and vary person to person.
Fantastic. Thank you. Okay, next question. So, okay. How many sessions of egg retrieval? I heard there's multiple sessions.
I can jump in there. So that depends on several factors. One is family planning goals, how many kids someone wants to have, when they want to start having those kids, female age at when they want to freeze their eggs, and egg reserve. Do they have more eggs, less eggs than average, so we can estimate how many eggs we're likely to get in a given egg freezing cycle. So usually in these conversations, once we flush out all of those details, we'll set a target number of eggs that would give a patient a high enough degree of certainty that they're going to be able to have all the babies that they want with those eggs. And in any case, we can set that target, and we always start with one cycle and we see how it goes, because for some patients the egg freezing process is not so bad, smooth, relatively easy, and for other patients it can be really challenging with significant side effects and an experience that they really don't want to repeat. So it's a step-by-step process where we're trying to both estimate how many cycles someone might need up front, while also seeing how the experience is for them, seeing how many eggs we get, and putting in all of those other factors to try to make those determinations.
Fantastic. Thank you, Dr. Najat. Okay, next question. Can my gynecologist look into infertility, or do I have to go to a fertility doctor? Dr. Wu?
You often will start your investigation into fertility with your gynecologist because you'll come and you'll talk about your periods and if they're irregular. And we can do the initial workup for, what your hormones are doing. Oftentimes patients who have a history of maybe blocked tubes or pelvic infections, we can send them for different radiology studies that will look at whether the uterus and the tubes are, normal and open. But in terms of starting drugs and things like that for fertility, you would see the fertility doctors for that first.
Fantastic. Thank you, Dr. Wu. Okay, next question. Does GNF have higher success rates compared to other fertility centers?
I can weigh in there. We do. Our lab is amazing, headed by our laboratory director, Dr. Alicia Broussard, who oversees all operations. And we have state-of-the-art equipment and an incredible team of embryologists and lab technicians who are performing nothing but the best when it comes to laboratory care in embryology and andrology and endocrinology. And we take great pride in that work with, routine and constant improvements in the laboratory to make sure that we're always providing the cutting edge technology and best success rates that we can for our patients.
Thank you. Okay, next question. With egg freezing batching, low AMH, 0.17 and 0.17, 34-year-old endometriosis, cyst fibroids, polyps, wants to start our family. When do you know it's time to move on to another plan? We have done 3 IVF rounds, 2 rounds high medication dose, and 0 embryos in the middle of a 3rd round with low dose. Wow.
I'm sorry, it's been such a tough process, and it's not easy even when it's easy to go through this. So with very low reserve, it can be more difficult because you're working with a lower sample size of eggs per round, which of course yields fewer embryos per round. So it depends on at what stage the attrition is happening. So if you're making embryos, but you're testing and they're not chromosomally normal, and that's a reason to keep going. But if there is repeated premature ovulation or no eggs retrieved, or the egg that's retrieved doesn't make an embryo at all, then it's time to, and that's happened repeated times, like even 2 times, time to regroup and think about something different. So if you're doing high dose, switching to very, very low dose, if we're going to be getting 1 or 2 eggs anyways, maybe very minimal dose is what's right for you. So there's no one right answer for a single person. So, but it depends exactly where it's happening in the process to think about what to do next.
Yeah, and I'll just add to that. I think that's all amazing advice. If you haven't had a second opinion from another center, it might be a good idea just to get a different perspective on how things might be done differently. There are a lot of smart people in this field and a lot of great IVF centers out there. And everyone is going to recommend something a little bit different. And sometimes switching the lab, switching the doctor, you might get a different outcome. So I would, at that age, 2nd, 3rd IVF cycle, I think there are still lots of possibilities for you. I wouldn't turn the page. It would be my general advice. Of course, I'd want to speak with you more about your experience before making such a firm recommendation, but I still think there's a lot more to explore out there.
Thank you, Dr. Naja. Next question. Okay. Is there a point when it's too late in the process for acupuncture to make a difference? Oh, interesting.
Yeah, that's a great question. And it really depends what we're trying to affect. I think if we're really looking at the outcome of the egg freezing retrieval process, the earlier the better. But we do have people that come just to treat the side effects and what they're feeling during that week of leading up to their retrieval. They're bloated, they're constipated, they're not sleeping. Sometimes even after the retrieval, they really are feeling uncomfortable. They'll come in really just for help with that. And then, of course, it's never too late.
Thank you. Okay, next question. Wow, the Q&A section is on fire. Okay, let's see. Vitamins, any help or not? Anybody want to take vitamins? What do we think? Supplements? Yes, no, maybe so?
It's always a tough one for me, honestly. I wish there was a supplement or a vitamin out there that I could firmly hang my hat on and say, all of our patients should be taking this, and we're going to see more eggs or higher quality eggs or higher pregnancy rates. And I just don't think we have that at this point, for better or for worse. That's my overall take.
Right.
I don't know what the others think.
There are some supplements that show improvements in some studies. Some don't. Like even the same supplement shows no improvement in other studies. A lot of these things aren't highly regulated, so you have to take it with a grain of salt. And if you're taking a preset supplement, look at the ingredients because, for example, CoQ10, maybe higher dose is what's recommended, but the preset ones may have a much lower dose of that. So just have a conversation individually with your fertility doctor about that. Sometimes if you have a history of breast cancer, endometriosis, you may not want to be taking DHEA, for example. A lot of things to consider with the supplements, but you're not doing anything wrong by your body by not taking them. It may only be harmful to your wallet, but we just don't know quite as much about that. But it's important to maintain a healthy diet, minimize processed foods, microplastic, that's a big thing coming up, very hard to control these things. And just have a varied diet, and you can take a prenatal vitamin for sure.
Great. Anybody else want to touch on vitamins before I move on to the next question? Okay. Next question. Even though I do see one that I wanted to ask. Oh, perfect. That was it. Yes. Can I do egg freezing with birth control, or would my OBGYN recommend changing it to an IUD? That's a really great question. Dr. Wu, Dr. Najat.
I do tell patients to stop the birth control pill because you're suppressing ovulation and preventing pregnancy. So when they are ready to conceive, I do have patients stop the pill. And if we know that patients have a lot of suppression from the pill, for instance, I have some thin patients that it takes them a year or 2 years to get their periods back after they've been on the pill. So if they are planning a pregnancy or planning IVF or egg retrieval, then we will, have them stop the pill at times. Most patients don't need to stop it ahead of time, but occasionally these patients where it takes a very long time for them to get their periods back, we will switch them to other birth control that doesn't have so much suppression prior to an egg retrieval.
Awesome. Fantastic.
I agree with that completely. I think that's perfect. Some patients who are on birth control pills won't need to go off for more than a few days, and others will need to be off for a month or two, or sometimes longer, for us to see a rebound in that ovarian suppression that was taking place while on the pill.
Great. Okay, next question. If you have fibroids, polyps, can you still freeze your eggs, or do you need to get them removed first?
Fibroids, you don't need to get them removed first unless they are in the way of seeing the ovary with the or accessing the ovary with the needle that we use to drain the fluid from the ovaries. But that's rare for that to happen. Polyps, if you have a large polyp that's concerning for precancer, cancer, then we'd recommend that's biopsied before doing stimulation with more hormones. But if you are told you have a very small polyp and at that time, that's not necessarily a reason to not do egg freezing.
Great. Okay, let's see. Next question. Here's that CoQ10. I heard that CoQ10 helps improve AMH. Is that true? I know we just talked a little bit about vitamins. Thoughts?
Not to my knowledge.
Okay.
I don't know. Anyone else?
AMH is the AMH is the count of eggs that we see available to grow. So I haven't heard that it helps with AMH necessarily, perhaps with quality in some cases.
Okay. Let's see. What is the best way to address infertility without wasting time, but also not jumping into IVF? This is interesting. Is it egg freezing or is there more too?
I mean, I think really a consultation with a fertility specialist would be the way to start in that with that question, just to help answer some questions about family planning goals and timing, do some baseline testing on ovarian reserve, like antral follicle count, AMH testing, ultrasound, and then talk about options. But really, like if we're talking about fertility preservation, egg freezing and embryo banking really are the options that are available to us.
Okay. Great. Let's see. Throughout the session, all speakers are referring to stats and focusing on women under 35. What about 35 plus? Should we still bother egg freezing or miss the boat? Okay, what do we think?
It's a great question. And I want to just throw out there that 35 has been a number that has been focused on so much in the past few decades in our field, but there's nothing drastic that's happening at 35 per se. There's no cliff at 35. Fertility peaks into the 20s, begins to decline in the 30s, that decline accelerates in the late 30s into the 40s. That is all true, but like there's nothing about 35 per se that I think like a switch flips and then things are different all of a sudden. So I think 35, if you're looking to freeze eggs or freeze embryos, whatever the case may be, not too late. Likelihoods of success are higher when we freeze eggs or embryos when younger, of course, but at 35 and even older, I think it's a totally reasonable option to help preserve fertility for the future if you're not ready now.
Great advice. Next question. Oh, this is okay. How long after an egg retrieval process can you start having sex again, etc.?
We usually recommend continuing pelvic rest, which is nothing in the vagina, no tampons, no tub baths for about a week after an egg retrieval process. And the same goes for cardio, jumping, twisting related exercise.
Awesome. Thank you. Okay, let's see. What is a good number of eggs to freeze if you want to have 2 to 3 kids?
It's a question that comes up all the time, and female age is going to be the biggest factor there to help answer that question. The younger a woman is, the fewer eggs she's going to need to freeze to get to that goal of 2 or 3 kids. So that'll really help drive the conversation.
Okay. Next question. Oh, wow. What happens if you embryo freeze with somebody and then you guys break up? That's interesting.
Yeah,
what do we
this is
do?
one of the big caveats with doing embryo freezing. Is what if you're not with that person anymore? They do have rights over that embryo too, and they if they don't permit you to use it, then you're not, the clinic cannot use it. If they are not together anymore, decide to go through a legal process where one member says you can use these embryos, I let you use them, but that's a separate process with a lawyer. Sometimes people who are making embryos with, let's say, like a friend, and they use or a former partner, they'll waive those rights, parental rights, from the beginning. But it is a very important thing to consider before making embryos with somebody, of course, because they can't be undone.
Awesome. Okay, that's That's good to know. Dr. Wu, do you have any insight on this, by the way? Or do you have any patients in this have ever been in a situation like this?
I actually haven't had patients who've made embryos with someone and then, had to figure out what to do with them. Luckily, they have just not used the embryos. And, when they're with a new partner, they have made more embryos. But
okay, so they've made more embryos with another problem. Gotcha. Okay, great. Okay, any other questions? I can't believe it. Let's see. Okay, are there lifestyle changes that can improve egg quality? Dr. Swanberg, anyone? What do we think?
We really like to focus on nutrition first, even before, supplements. I know it just came up. I think it really makes a difference how you're feeding all the cells of your body. So that would be my go-to. Of course, acupuncture as well. But I don't know. I'd love to hear what the docs think.
Yeah, I mean, alcohol consumption, cigarette smoking also come to mind. I don't think small amounts of alcohol are going to significantly affect likelihoods, but excessive amounts certainly can. And cigarette smoking is clearly probably the single worst thing someone could possibly do for their overall health and the health of their eggs and embryos.
Amazing. Thank you for that. Any other questions before? Oh, okay. Will my OBGYN tell me if I'm at risk of infertility or is it up to me?
So I do often have discussions about infertility with patients. I think many women in New York City, they are delaying childbearing. So they do worry about, having problems with infertility. They also hear from their friends about their friends' problems with infertility. I look at their family histories and, sometimes if they've had surgery on their ovaries or surgeries for endometriosis where they've had ovarian resections, I will tell them, that there may be a delay, a decrease in their fertility, and that they may want to freeze eggs when they're younger versus older. It's something on an individual basis, but we do explore it all the time, and we often talk about fertility because patients are thinking about when they can possibly have a child. They have education and career decisions to make. And so they know that they'll delay childbearing. So patients will often ask me in their 20s about how fertile I think they'll be in their late 30s. And I think no one can really answer that. And I tell them no one has a look into the future, but that you are more fertile now than you are in 10 years, in 20 years. And so, you want to make some decisions that can help you preserve the ability to have your own biological child.
Amazing. Thank you. Okay, let's see. When do you switch from seeing the fertility doctors to the OBGYN? Is it as soon as the egg sticks? Okay. So when you're an OB grad.
So usually at a fertility center, when somebody is pregnant from an embryo transfer, we do watch and make sure pregnancy hormone levels are going up as we expect. And we even do weekly scans up until 9 or 10 weeks gestation, but some choose to switch their OB after 8 weeks, and that's fine. So usually we can see up until 10 weeks, but some switch their OB before that and always after 10 weeks. That helps answer that question.
Awesome. Thank you. Dr. Wu, do you care to jump in a little bit on that question? Or do you see people, especially if they've come from a fertility practice and they've struggled with infertility, are you open to seeing them sooner or getting them into the office? I know sometimes it can alleviate some stress when they're, they just graduated. How does that impact your office?
We typically do get the patients after they graduate between 8 and 10 weeks. But we have also gotten patients at 6.5 weeks patients who've gone to other countries, had their IVF and just come back. And, we're happy to see them earlier also and help monitoring.
Great. Okay. Any other questions? Oh, does Chinese medicine help?
So acupuncture is a part of Chinese medicine. When people ask this question, I think they're usually asking about herbal medicine. All of our doctors of Chinese medicine at Indigo are herbalists as well. And we will use herbs for more like cycle regulation issues before we get to this process. So if somebody comes in and they have, really terrible PMS or very painful periods, sometimes we are using herbs to help with that. But by the time they're working with a reproductive endocrinologist and they're really going into this tightly controlled environment, we don't use herbs. I'm sure there are people that do, but we like to work closely with the doctors here. And there have been a few cases where somebody's had multiple IVF failures and have never made an embryo, where we've, in conjunction with the entire team, decided, hey, let's try this. It could really help based on this specific pattern or what we're seeing. But in general, only in that kind of time period before we're on this path.
Great. Thank you for that. Okay. Have you ever had patients where you have done multiple IVF cycles and it just never worked, or generally it always works, even after a few cycles? And does the longer you freeze an egg, does anything deteriorate while frozen?
So, yes, certainly. There are many cases where we do multiple and it never works. And a lot of the time that is, again, back to the age-old thing that we say is female age. And it's also based on number of eggs and other factors too, because the difficulty may be with making the embryos, but there are other things that are important as well, including the uterus, uterine implantation. Recurrent implantation failure is rare, but that happens as well. So that means after you get an embryo that appears viable. So yes, that can certainly happen, and the factors of success are based on all those things. For the longer you freeze an egg, it does not affect how long you freeze an egg. It's stored in liquid nitrogen. It's not in a freezer plugged into the wall. So power goes out, those eggs or embryos are safe because they're still in liquid nitrogen. And that those levels are always replenished and monitored. So it doesn't deteriorate while frozen. There are still babies being born from, I think, now 15, 20-year frozen eggs are still making babies.
Yeah, I read that article actually about how the baby was technically like older than the parents or something like that because they were young and trying to conceive, and it was just an embryo that was donated from quite a while ago. So amazing. Okay, I can't believe it. This time flew by. We had so many great questions, and we are already at our 5-minute warning. So I just want to thank you all so much for these amazing insights. I think we all learned a ton. If you have any more questions on egg freezing or want to connect with our speakers, please don't forget to check out the doc section to your right. And up next, we have Food for Thought, where we'll be diving into nutrition, weight management, and even GLP-1s. So we are so grateful and thankful. And I look forward to hopefully getting this panel together again soon.
Thank you, guys.
Thank you so much, everybody.
Wow.
And thank you very much, Dr. Wu, Dr. Swanberg, Dr. Sechkin, and of course, Destiny, for putting it all together.
My pleasure. So excited. Thank you, guys, and we'll see you soon.
Take care.
Bye.